that provide a direct or indirect impact on helping to reduce the rate here. Our initiative started probably in March of 2005 when the Commercial Appeal ran a series of articles about infant mortality in our community. And in April of 2006, former Commissioner Kenneth Robinson, along with Governor Phil Bredesen and Shelby County Mayor A.C. Warden, hosted a summit here in Shelby County where we had 250 stakeholders in the community to attend. As a result of that, a core leadership group of individuals will form. They meet monthly to look at policy, identify funding, and issues surrounding infant mortality in our community. As a result of that, they had identified funding to upgrade obstetrical care at a couple of the Health Loop clinics in an effort to improve OB care for women there. They found funding to bring 2 programs into our community, one grassroots program called Community Voice and another called Centering Pregnancy, which is a clinic-based program that was evaluated at Yale. And the last thing that they have done recently is bring funding to our community for FEMUR, which is called a Fetal and Infant Mortality Review Team. And that team will help us to look at other things that we may not have, that we may have missed in trying to identify what some of the causes are of infant mortality in our community.
Thank you, Antoinette. Dr. Coronas.
Where do we go? Is this the right approach, do you think, that Antoinette is leading with Shelby County?
Almost any approach is going to be the right approach for where we are with infant mortality. When we started the Newborn Center in 1968, 40 years ago, I was pretty naive, and one of my goals was going to lower infant mortality. And as statistics accumulated, after about 6 or 7 years, I looked at it from a different angle, and yes, indeed, among the babies who were admitted to intensive care, we did indeed improve the mortality. But our customers kept coming, and we needed to go out of business. And it was quite obvious that A, we hadn't done a thing to the incidence of prematurity, B, that mortality is very substantially a problem of premature babies, and C, that we were going to get nowhere with the public statistic of infant mortality as we're talking about it if we only concentrated on our intrinsic operations, our procedures, our hand washing, our latest techniques, our latest apparatus. That's all to the good. But here we sit in Shelby County with the same infant mortality virtually that we've had. It was an accepted fact of life that characterized this community and brought on shrugged shoulders. Now we're serious about it.
I think you're right. The more things change in the sense that there is more public awareness, there's more public outcry now because of the media, as Ms. Holman has said, because of some of the efforts to raise the awareness of the plight of our mothers in Memphis, Shelby County. We are more aware, and I think things are being addressed. However, as they say, the more things change, the more things remain the same. When we think about the fact that there are these racial disparities, they're not just differences, but these are differences that ought not be. And in Memphis, Shelby County, we are struck by the need to go deeper, as Dr. Coronas has said, deeper than the clinical approaches, deeper than the neonatal intensive care units. We've got to go further than the kinds of extraordinary interventions that are occurring in our hospitals and deal with some of the social determinants of health, deal with the preconceptual maternal health, deal with moms and women who are of childbearing age, deal with the environments in which they're living, focus on some of the other issues, and these are much harder to address. But I do think that awareness is there. We simply have to do more and to do it more urgently so that we can turn the tide.
I think, yes, it is not, there are social and medical issues. I think that from the social issues, I think that everybody can name, what we need in this area, from education, more prenatal care, and so on. From a medical point of view, I think that what this area needs is also more doctors with expertise, for example, in maternal fetal medicine. It is not a coincidence, in my opinion, that Tennessee is number 46 in terms of infant mortality in the United States. And in Memphis, before I came, there were only 4 maternal fetal medicine. And this is an area that needs probably 15 maternal fetal medicine. I've been fortunate to recruit more maternal fetal medicine, and now we are a group of 6. We have 4 maternal fetal medicine and 2 geneticists.
So we need more specialists.
I think so. It is a part of a package. We need, of course, to improve the social issues, but at the same time, we need also more specialists. Yeah.
Well, we're going to get into the social aspects of this as well as the medical parts of this. It's certainly a battle when it comes to tackling the problem of infant mortality. Let's take a few minutes now to meet one healthcare worker who is on the front line making a difference.
I'm Dr. Linda Moses. I'm a board-certified obstetrician gynecologist. My primary duties are at the Hollywood Health Loop. Hola! The Health Loop is part of the med at this point. I see mostly obstetric patients or OB patients. I talk to my patients about their plans, their goals, and if they don't have any, that they should have some. In addition to educating them about the signs of preterm labor, basic health maintenance, things that they should also be aware of. The way the med and the loop is set up, that we just see the patient and then work with the financial part. You bring the patient, take care of the patient first, and then look at the finances second. Hollywood Health Loop is in 38108. That's the community that I grew up in. I was born at the med, grew up in North Memphis. Growing up in 38108, for me as a kid, it was fun. I didn't know I was poor. I didn't know that I was indigent. I had a mom and a dad who loved me very much. 38108 was a happy place for me growing up. At the age of 8, that's the earliest that I can remember that I said I wanted to be a doctor. And I can remember one Sunday afternoon playing in the backyard, and my father and his father were visiting on a Sunday, as they usually do. And I said, "Granddaddy, I'm going to be a doctor." And he looked at me, he said, you can't be a doctor, baby. I said, "Why not, Granddaddy?" He said, "Well, they don't let women be doctors." I said, "Well, I guess I'll just have to show them different." When I graduated from high school, when they were doing our yearbook, they asked us, "What do you want your book to say about you?" The quote that I put in the yearbook for me was that I wanted to go to school to be a physician so that I could help all mankind. My focus in med school was I'm strong enough to do this, I can do this, and it was basically just to get back home. My whole focus was to come home and provide the role model, the doctor in the community that I did not have growing up in this community. Okay. ¿Tienes preguntas, mami? No. Okay, también. De nada. Because as a child growing up, I had mom and dad and sisters. I didn't have any real role models in my community. And being poor, a lot of our primary care was emergency room care. And today I still see that a lot of people use that as their primary doctors. When we have community clinics like this one, that could take a lot of the pressure off. And part of it is education. Just didn't know any better. I think that education is the key to helping those like myself who grew up in an underserved area to move beyond that and exceed beyond that.